So here at Oklahoma Children's Hospital, we have a postpartum newborn unit, which is a 36-bed unit, and we provide normal postpartum newborn care. We also have an obstetrical special care unit that's a 30-bed, high-risk antepartum, high-risk postpartum unit for moms with complications before pregnancy and delivery and after delivery. And then we have a 20-bed labor and delivery unit that also encompasses a 3-bed PACU, a 3 OR suites, 2 step-down ICU beds, and a 6-bed emergency room for obstetric patients. So within that, there's a hospital within a hospital here, and we can provide a lot of care for our patients. So as you come to work with us here at Oklahoma Children's, is you can start in any unit that you would like to start in and continue to grow your career and expand your knowledge of women's health and how we provide care for the obstetric patient. So one way that our women's service line is unique to Oklahoma is we deliver in Oklahoma Children's Hospital. And that's important because we have a lot of different service lines that can support us. So we deliver patients that are very low risk, that have no complications, here to just expand their family. And then we have other patients trying to expand their family but may have had complications. So they may need to be hospitalized for an extended amount of time before delivery, or they may be transferred to us from other places. But we have excellent care, excellent support, and we provide from the lowest level of care to the highest level of care. But we're fortunate that we have 8 MFMs on staff at all times. So that's maternal fetal medicine physicians that can provide high level of care for any woman that's experiencing any complications within her pregnancy. And oftentimes it's not just the mom's complications, but there may be some fetal complications as anomalies, cardiac issues, and they provide excellent care to the mom so that we have a safe and comfortable delivery for her. And then we have the professionals available to take care of the baby at delivery.
So as far as expanding our skill set goes, we deal with situations kind of like medication administration, things like that that you might not get at a hospital that doesn't really deal with the situations that we deal with, like magnesium administration. We deal with like baby medication administration, IV starting, things like that that you might not get in other places too. We do have a NICU, but we still do take care of a lot of newborn problems on our own too. So we do kind of deal with those kind of things as well. I think our teamwork is one thing that I'm very, very grateful and proud of my unit in particular. We have a lot of patients, and sometimes our patients can require higher care, but our supervisors and our managers are always there and willing to step in and help us as soon as we have an issue. Even other nurses, and they might have a full load, but if they see we're struggling, they're the first people to hop in there and help us. And as far as growth is concerned, we have a lot of nurses who are going back to school and pursuing their BSNs and pursuing their MSNs and their master's degrees and things like that, and we're all very flexible with our schedules, and we're all willing to change with each other to kind of fit everybody's like educational needs and their schedules, and I think we're all just very supportive of each other in that way, not only kind of in our unit but like also in our personal lives as well. To other RNs, I think what we can gain from being an employee here at Oklahoma Children's Hospital is we take care of such a wide variety of like patient populations, from very healthy patients to patients who might need a higher level of care. You kind of get that entire spectrum, so you kind of learn how to deal with a multitude of different situations, and I think that's very helpful to have in your career as a nurse.